What is dysautonomia? Well, dysautonomia is a condition that is widely overlooked, misunderstood, and poorly cared for in today's traditional medical model. Now, as parents, we all dream of a life where our kids are happy, healthy, and absolutely thriving. But for hundreds of thousands of families today, when this perplexing condition called dysautonomia then sets in, their child begins to suffer from daily debilitating issues ranging from mood disorders, gut problems, chronic pain, muscle weakness, syncope episodes, and so much more. Dysautonomia is also a significant underlying factor in things like autism, ADHD, sensory processing disorders, seizures, POTS, PANS, and PANDAS, all of which are now seen at significantly higher rates than they were just a few years ago. While traditional medicine can sometimes offer symptom relief, many parents often wonder if there's something more that can be done to help get to the true root cause and help their child achieve full recovery and optimal outcomes from dysautonomia and all of its related health challenges. So in this video, we'll explain what dysautonomia is, what causes it to develop, what associated symptoms and health challenges come with it, why it's often overlooked, and how neurologically focused chiropractic care may be the missing link in restoring your child's nervous system balance through cutting-edge new techniques and clinical protocols. Now for Francesca, a 17-year-old with health struggles that ruled her entire childhood. She was plagued by seizures since she was 7 years of age. Then worsening fatigue, anxiety, and eating disorder, and constipation through puberty. Her quality of life, it just suffered. And despite constant medical care, doctors really had no explanation for why she was experiencing such a multitude of symptoms all together. It often seemed like they were simply treating a random issue in isolation versus getting to the one real root cause. That was until Francesca's mom learned about dysautonomia from a friend. One trip to a specialized chiropractor then changed everything. So what is dysautonomia? Well, dysautonomia is a breakdown affecting the autonomic nervous system, which is the master control center managing nearly every organ and system in your entire body, from digestion and regulating inflammation to breathing and blood pressure regulation. Now, when it's not functioning properly, dysautonomia throws off communication between the brain and the body. It manifests diverse symptoms that differ based on which organs are impacted. The most common symptoms, such as gut issues, anxiety, heart palpitations, and fatigue, are related to the most commonly affected systems, which are the digestive system, cardiorespiratory system, and the brain. So what really triggers or causes dysautonomia in the first place? Well, not only do traditional medical doctors and neurologists struggle to properly recognize and effectively treat dysautonomia, they also struggle to explain what's really causing it. Now, our clinical observations and research review a highlight of 5 main triggers of dysautonomia. You've got prenatal or maternal distress, such as a high risk or high anxiety pregnancy, which exposes the developing fetal nervous system to excessive stress hormones in utero and may lead to an underdeveloped vagus nerve and parasympathetic nervous system. You've also got birth interventions like forceps and vacuum extraction, C-section, leading to physical injury and trauma that lead to biomechanical misalignments and subluxations in the upper neck and back areas, which then negatively impacts the function of the vagus nerve and parasympathetic nervous system once again. Then you've got vagus nerve injury, damage, and dysfunction that are without a doubt the leading cause of dysautonomia. Then there's altered development and missed milestones. Those altered development and missed milestones may leave the brain and nervous system underdeveloped, off track, and less resilient and adaptable later on in a child's life. Then you've got things like recurrent infections, ongoing gut issues, chronic inflammation, and overuse of antibiotics and other medications throughout the child's life. And then there's chronic sensory challenges and anxiety in kids. It triggers a continual stress response and excessive stress hormones for these kids. And over time, this cascades into a vicious cycle where an overdriven nervous system fails to regulate itself properly, called, you got it, dysautonomia. Now, once dysautonomia sets in, The patient struggles to properly maintain homeostasis, which is a fancy word that means the ability to regulate the nervous system and adapt to regular daily stressors and routines. But guess what? There is hope. While traditional medicine continues to lag behind on their understanding and proper care of dysautonomia, there's an entire network of specialists called neurologically focused chiropractors who have a deep, deep understanding of dysautonomia and can provide a drug-free clinical approach that addresses the root cause head-on. This unique and cutting-edge approach begins first with a deep dive into the patient's case history to find out if any of those 5 perfect storm risk factors of dysautonomia had occurred. From there, we get to a really exciting part, our Insight neurologic scans and heart rate variability technology. Now, these scans can find and detect the presence of neurologic dysfunction and dysautonomia at an incredibly advanced and in-depth level, going far beyond what traditional medical testing like blood work, MRIs, or even an EEG will reveal. Now, the most important element of these incredible scans is that HRV exam, which is the gold standard for finding dysautonomia and then being able to track and measure the positive improvements in that autonomic nervous system function as the adjustments begin and the care progresses. The doctors in our PX Docs network are trained specifically to care for dysautonomia without drugs, and they know how to use specialized techniques and clinical protocols that seek to restore balance to the autonomic nervous system, activate that vagus nerve, and over time, help the patient regain an incredible quality of life. Now, I want to share something with you. Here is an example of what HRV looks like. This white dot right here is charted on this graph and put into an algorithm. It only takes 3 minutes to do this test, but what this is showing is that white dot, or in this case, this child, is shifted out into a sympathetic fight or flight mode as you go over this direction. And you can also see that it's dropped lower than that green zone, meaning their internal battery or nervous system performance is exhausted. In fact, distressed. So we have the ability to go through and actually measure where a child or an adult stands when it comes to dysautonomia. To learn more about dysautonomia and how neurologically focused chiropractic care can be the missing key to a drug-free relief and neurologic restoration, comment below, send us a DM, or see the link in our bio to learn more.